Today I will be presenting an informative speech about hepatitis B. What I hope to inform you about today is what is hepatitis B, how can it be prevented, what causes it to be spread, the signs and symptoms of it, how you can test for it, and your treatment options if you are infected. So I have here what is hepatitis B? Hepatitis B is an infection of the liver. When it enters the body, it causes inflammation and scarring, and more seriously, it can cause liver cancer and cirrhosis. Cirrhosis is the hardening of the liver, and I obtained that by looking at care notes databases. How can it be prevented? Well, it can be prevented by getting hepatitis B vaccinations. You have to have 3 vaccinations. Each are the initial one, you have to wait 6 weeks to get the second one, and another additional 6 weeks to get your third one. And this vaccine is for both the acute illness and the serious chronic condition, which is, the liver cancer or the cirrhosis. And pretty much how it is spread is by a mother to her unborn fetus, by the sharing of needles in an infected person, or accidentally sticking yourself if you're in the healthcare profession. It also is spread by any bodily fluids. It could be saliva, it could be mucous membrane, blood, any of that from a foreign person who you do not know and might have the infection can also be spread to you. And the most common infection is unprotected sexual activity. Even if the person is asymptomatic, which means that they do not show any signs or symptoms of having hepatitis B, it could still be spread through sexual activity. So how can you test for hepatitis B? You can do a simple blood test to check for it. You just go to your doctor and they obtain a blood sample from your arm. They put it in multiple tubes and send it to the lab for testing. And that was something I gathered from clinical reference systems. And the treatment options, if you are infected, the one that I looked more particularly into was oral medication. So you can take oral medication if you are chronically ill with hepatitis B, which means that you've had it for over 6 months to a year, makes it chronic. So your medication that I discovered during my research was Indicavir, or Bariclude, which is a generic name for it. This is an antiviral medication used to treat the hepatitis B as a chronic infection, and that I gathered from ProQuest Health Medical Complete. Well, that was just a quick brief about hepatitis B and why it's important for everyone to be careful, because this virus is actually number one right now in Texas, and it is being spread more than HIV and AIDS combined. So it is very important for everyone to be aware of what hepatitis B is and the ways that it is spread and how to be treated if you ever happen to have those signs or symptoms. So I hope you guys gathered a little bit more information about this topic, and I hope that helped. Thank you.